worms in your brain, creepy crawlers in your skin, and creatures in places they absolutely shouldn't be. As an ER doctor, I've seen a lot, but few things spark pure full body shivers quite like a parasite. That's why today we're counting down 5 of the most disturbing and excruciating parasites humans can encounter. All right, let's dive right in. Number 5, Botfly Larvi. Ever feel like something's wiggling under your skin? If you've got a human botfly infestation, you're not imagining it. This parasite is mostly found in Central and South America, and it has a disturbingly clever delivery system. It lays its eggs on mosquitoes or other biting insects. When that mosquito bites a human, congratulations! You've just become an incubator. The warmth of your body triggers the eggs to hatch, and the larvae drill themselves right into your skin. They build a little breathing hole so they can keep feeding and growing deep inside your tissue. We're talking red, swollen boils that actually move. Some patients say they can feel them shift or squirm at night. Others say if you press on it lightly, you can feel a pop or see a tiny part of the larva peeking out. Some even report a faint scratching sensation or tickling feeling like something trying to escape. That larva can stay in there for weeks, feeding on your fluids and tissue until it's fully mature. Then it wiggles its way out and drops to the ground to pupate. You can try old school tricks like smothering it with petroleum jelly or nail polish to cut off its air supply so it wiggles out on its own if you are really in a pinch. But most people, they head to a doctor to have it surgically removed under local anesthesia. Physically, people rate it about a 6 or 7 out of 10. Sharp stings, throbbing, itching, but the psychological horror, easily a 10. Just knowing there's a living creature feeding and growing under your skin is enough to haunt your dreams for years. Number 4, guinea worm. This one's not as common anymore, but it's the kind of case that sticks in your mind forever. You get infected by drinking water contaminated with tiny water fleas carrying guinea worm larvae. And at first, you feel nothing. But over the next year, those larvae mature and slowly migrate through your body's connective tissue, some growing up to 3 feet long. Then, out of nowhere, you notice a tender spot, often on your feet or lower leg. Then a blister forms. It burns like fire and it ruptures. That's when you see the pale spaghetti-like worm beginning to emerge. And here's the horrifying part. You can't just yank it out. Nope. If it snaps, the worm's body can recoil deep inside, releasing fluids that can trigger a violent immune reaction. Fever, swelling, infection, sometimes even locking joints or permanent damage. So what do you do in this terrifying situation? The traditional treatment is ancient and brutal. You wind the worm inch by inch around a small stick or gauze if you are in the hospital, gently pulling for as long as it takes until the entire worm is out. A single worm can take days of agonizing extraction, and patients often describe it as a slow motion torture. The burning sensation when the worm starts emerging is so intense that people instinctively plunge their foot into water for relief, but that's exactly how the worm spreads its larvae. The good news, guinea worm disease is on the verge of eradication thanks to clean water initiatives and education programs, with cases now down to just a handful worldwide each year. If you're unlucky enough to get one, you and your doctors will likely never forget it, and you'll probably never look at drinking water the same way again. Number 3, Olaoa. It's spread by the bite of a deer fly in parts of West and Central Africa, and after initial infection, it begins a slow, unsettling migration through your body's tissues. Weeks or months later, you might notice something strange because the worm doesn't stay hidden. At some point, it can make its way across the surface of your eye or under the delicate skin of your face. Patients often describe redness and irritation, a burning or stinging sensation, and the distinct feeling of something alive crawling through the eye. A colleague of mine once described it as like watching something completely unreal happen in real time. Imagine blinking and literally seeing a thin white worm thread its way across your vision. If untreated, this parasite can wander further, sometimes even migrating to deeper tissues. tissues. It can continue to migrate through the layers beneath the skin, traveling through subcutaneous tissue, slipping around muscles or tendons, and in rare cases, even reaching the central nervous system, where it can cause serious complications such as encephalitis, a life-threatening inflammation of the brain. Treatment usually involves carefully managed anti-parasitic medications, but in some cases, the safest and most effective option is to physically remove it with fine forceps while it's still alive and moving. While the pain itself isn't usually severe, the unnerving sight of a living worm traveling across your own eye is an experience that lingers far longer than the sting. Number 2, hookworm. Hookworms don't usually get top billing in the parasite world, but they absolutely earn it, especially for the way they make their entrance. These parasites thrive in warm, moist, contaminated soil and penetrate bare skin in a matter of minutes, most often through the thin skin of the soles of your feet. You might feel nothing at first, or just a mild itch. But once they're in, the journey of hookworm hell begins. After breaking through, they hitch a ride in your bloodstream, traveling silently through your body until they reach your lungs. There, they mature a bit, trigger irritation, and make you cough. When you swallow that cough back down, you've just delivered them straight to their final destination, your intestines. And that's where the real trouble starts. Hookworms latch onto the lining like tiny vampires, feeding on your blood day after day. Over time, that constant blood loss can lead to iron deficiency anemia, extreme fatigue, and gnawing abdominal pain. In children, heavy infections can even stunt growth or cause cognitive delays. Good news, in this not so appetizing medical complaint, hookworms can be sneaky, but they're also very treatable. Once diagnosed, usually through a stool test, doctors prescribe antiparasitic medications such as albendazole or mebendazole. These drugs work by killing the worms in your intestines over the course of just a few days. Most patients recover completely once treated, but the key is to catching them early because left untreated, these little bloodsuckers can linger for years and cause long-term damage. Number 1, Echinoccus granulosis. This one's less about the squirm and more about the sheer internal chaos. Hydatid disease is caused by the Echinoccus tapeworm, most commonly picked up from infected dogs, livestock, or contaminated food and water all around the world. And once ingested, the microscopic larvae slip into your bloodstream and quietly embed themselves into major organs, most often the liver, but also sometimes the lungs, and in rare but devastating cases, even the brain or bones. It's there in your organs where these sneaky little suckers build what are essentially parasitic balloons or fluid-filled cysts that can grow silently for years. Many patients don't even realize anything is wrong until the cysts get large enough to press on surrounding structures, causing vague pain or coughing if it's in your lungs. The real danger comes when one of these cysts ruptures. That sudden tear can release millions of tiny larval particles into your body at once, setting off a cascade of trouble. A violent anaphylactic reaction for starters that can drop your blood pressure in seconds. Then you've got intense abdominal or chest pain, fever, vomiting, and in severe cases, death if not treated immediately. Treatment is neither simple nor quick. Surgeons often have to carefully remove the cysts meticulously because puncturing one during surgery can cause the same catastrophic spread. So there you have it, 5 of the most painful or downright disturbing parasites that humans can get. If you've ever had one of these or know somebody who has, drop it in the comments. And hey, don't forget to hit that subscribe button, turn on your bell notifications, and hit that like button for me. That way you don't miss a future video. Thank you so much for watching and stay healthy, my friends.